going to do my NG tube insertion video. I will start by reviewing the orders for the NG tube, make sure it's appropriate. I will verify that the patient doesn't have any allergies or any contraindications for this procedure. The patient is also getting a heparin injection, so I will verify the orders for that, the dose, and make sure that there's no contraindications, any medications that shouldn't be taken with the heparin. And I will have already done a bowel sound assessment beforehand. And at this point, I will bring all my supplies with me. Knock on the door. Hi, my name is Claire. I'm going to be your nurse today. I'm going to be inserting an NG tube like we talked about, if that's okay with you. All right, I'm going to provide patient privacy, perform my hand hygiene. And could I get your full name and date of birth?
Sure. Tran Nugent, 2-8-48.
Okay, just gonna verify your wristband. All right, and at this point, I will go ahead and do a visual for that. I will put on my clean gloves after performing hand hygiene. Clean gloves on. I'm gonna go ahead and do a visual inspection of the nose. All right, I'm looking for any trauma, polyps, obstructions, bleeding, anything that would contraindicate an NG tube insertion. And I'm also going to use a tongue depressor and look in the mouth and just make sure that there's no trauma or any contraindications there. All right. I'm going to spray my lidocaine in the nostrils. Wait 5 to 10 minutes for the lidocaine to kick in. It's been 5 to 10 minutes. And at this point, I will go ahead and start setting up for the NG tube. So making sure the patient is at 30 degrees in the bed. Then raise up the bed. Raising up the bed to a comfortable working height. Taking out my tubing. All right, for the tubing, I'm gonna move this towel so I can palpate the xiphoid process. Okay. My tape as a marker for how deep I need the tube to go. Place the towel. I'm going to spray my lubricant on the tube to ensure easy insertion without causing trauma. So now this is lubricated. I'm going to check the suction, make sure it has intermittent suction working. Okay, checking suction, turning it off for the moment. All right. So how this is gonna work is I'm gonna have you tuck your chin to your chest, and every time I'm gonna have my assistant come over and provide you with some water. So every time I say swallow, you're gonna take a sip of water, and I will insert the tube further. During the procedure, you're gonna feel some discomfort, might activate your gag reflex. So if you're in too much discomfort or any pain, just raise your left hand and we'll stop the procedure. And so now if I can have you tuck your chin to your chest. All right. Okay. And I'll have you swallow and swallow and swallow, 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 swallow. All right. How are you doing, Tran? Thumbs up. Okay, perfect. And I'm just gonna I would either use a stat lock or tape to secure this. It's not sticking very well, but that's okay. All right, so now I'm going to aspirate. So this is to check the pH contents of the gastric secretions. Put this in the tube. Taking my pH pH stick and check the pH. It is 3, which is an appropriate pH for proper tube placement. And so now at this point, I'm just going to take a little bit of tape, fasten the NG tube in place. I would have done this sooner. It's a correction. I would have done this sooner. And I can just remove this towel as well. And normally I would probably use another method of adhesion, but just using that. Just moving that out of the way. Okay. All right, it is on intermittent suction. Now, how are you doing, Tran? Doing okay? All right, so we're gonna move on to the heparin injection. Getting my supplies situated. So the heparin injection is 5,000 units for 1 ml. So we're gonna use 1 ml of heparin. At this point, I will change my gloves. We'll use hand hygiene. Put on my gloves. Okay. All right. So take my alcohol swab. I've selected an area on the patient's stomach Going to wipe the area with an alcohol swab. Let that dry for 30 seconds. Meanwhile, I'm going to prepare my heparin injection, scrubbing the top of the cap for 30 seconds. It's been 30 seconds, letting that dry. Okay. And the order is for 1 ml. Get out 1 ml of air. Push the air in. Invert the tube. I'm trying to avoid bubbles as best as I can. That accidentally came out. These tubes are a little bit pressurized. Okay. Getting the excess medication out. Squeeze, insert at 45-degree angle. Insert the injection. Dispose of this in my sharps container. For now, I will recap, but I would dispose of this in my sharps. Okay, and is there anything else I can get for you, Tran? Okay. There's my gloves, pharmacy and hygiene. All right, lower the bed. To lowest position. All right, call light is within reach. Pharmacy and hygiene upon leaving the room. At this point, I would document in the MAR the heparin injection, location, dose, time, and the NG tube. I would document placement, size of the tube, how the patient tolerated it, and I would also recommend an x-ray to verify placement. Also collate bowel sounds afterward. And that is my video. Thank you.